Hello, lovely people. So you join me here today where I'm about to go live on Expat Radio with Bill Anderson. So you'll be joining us very, very soon. A little bit of Simply Red playing in the background, a little bit of pause whilst they transition over to me, okay? So just bear with me one moment, and I hope you're having a great Friday. Remember, today's topic is going to be LBP, which is lower back pain, and it's going to be about sciatica and whether or not you actually have it, because the chances are you probably don't. So let's see. Okay, bear with me.
You're listening to Expat Radio, your worldwide friend. KMCMS, the place for all your cleaning and janitorial supplies, is proud partner of the All Day Special on Expat Radio. Hi, I'm Robert Powell. You're listening to Expat Radio.
So it's Expat Radio, in case you're interested. That's what we're on. We're getting there. There's a little bit of intro happening here, so soon enough we'll be going live. You'll hear Bill introducing me. It's quite a jingle, that, isn't it? Just skip forward. If you're watching on replay, just skip forward a little bit.
Good afternoon from the Costa del Sol and Lumbago. It's a fresher day today. It's only about 29 degrees, but the humidity's gone down, so it feels much more pleasant. I am delighted to have back with me today Marcel Salazar.
Hello.
You've got the family all back with you again, is that
I
right?
have. They've returned from their vacations. Reluctantly, they returned.
Right.
But yes, they are all back now, so all safe and sound.
Yep, so the peace and quiet is gone.
Correct. It's now complete chaos, but thankfully I'm very busy at work, so I'm barely at home, so it's absolutely ideal. I'm very happy.
So, Marcel, I'll let you introduce what we're going to talk about today, and I'll ask all the silly questions, okay, because that's my job.
Please.
So what is the topic that you want to pick up on today?
So the topic of today's chat is basically a topic that is firstly extremely common within my practice and within the industry as a whole. And that is, I've abbreviated it to what's called LBP, which is the terminology that we use, which is lower back pain. And also what's connected with it is sciatica. And basically the fact that you probably don't have sciatica, even if you think you do.
All right.
And that's what I wanted to talk about, because a lot of people tend to think that they do have sciatica, but actually 90% of the time it's not that. It's a misdiagnosis, and we're going to talk a little bit more about it.
So we'll talk a bit more about that. But this is the first of my kind of silly questions. Is this sort of related to what we used to refer to as lumbago?
Right, lumbago, love it. That's an excellent question. So lumbago, first of all, is a very generic term for back pain. So it's non-specific back pain, and I remember when I was learning about it and then started hearing it from patients, and it's a very easy term for, let's say, doctors to say, you have back pain, but I don't know what it is, so let's call it lumbago. So that's what lumbago is really. It's a non-specific back pain.
Right.
Okay. But what I mean by specific is that there's no clear diagnosis as to where that's coming from, and then you'd ideally come to see somebody like me to get clarification.
Okay. So when we were chatting by message earlier this week, I said something like, everybody over 40 knows something about that, and your comment was, not just over 40.
Correct, absolutely. So you're absolutely right. Of course, most people over the age of 40 are very familiar with getting back pain and so on. But actually, 80% of people, to be honest, over the age of 18 experience back pain at some point in their life. Now, that majority also can occur particularly for physically active people, but equally so for those non-physically active. And where we're seeing a change now is our work circumstances. So if you imagine that you used to have an office that you used to at least travel to, right? And so you'd get up, you'd get dressed, you'd go there, and then you'd come back. Now, you might be sitting at your desk for 8 hours a day, which wouldn't be helping. But now, if we've got a home office, then we're literally there from the moment we wake up. We might have breakfast, but we walk, 15 meters maximum, and then we're sitting down again. So that can exacerbate and create this problem of lower back pain correlated to weakness. So that's an area of or a cause of lower back pain that also we're going to either talk about in more detail or now. But that's where we're now starting to see younger people suffering from back pain, whether it be lower back pain, mid back pain, or even neck pain.
So is that partly to do with the loss of kind of muscle mass, because we're not really doing the kind of physical jobs that perhaps once were our lot?
It all comes down to that. That's exactly what it is. So we are not designed yet as humans. We haven't evolved to simply be stationary in one position and then push keys on a keypad. That might happen over time, whereby we become very immobile and soft and blobby. But for now, we have muscles and we have bones, and they need to be loaded and stressed. And the effect of gravity through motion makes us stronger, improves our joints, improves our the integrity of our joints and so on. But when you eliminate that in a seated position for extended periods of time, then your body as a whole starts to weaken, and that can primarily affect your back along with other places.
Yeah, so is the back a kind of weak spot then in that sense?
It is in the sense that because, okay, so we're Homo erectus, right? That means we are upright. When we're in a seat, we're not. We're in a flexed position. Now, we're not designed to be in a flexed position for extended periods of time. We have, in fact, our gluteal muscles, our buttock muscles, are designed to keep us upright. That's what separates us from chimps. We're much more comfortable in an upright position because we have highly developed buttock muscles which keep us upright and maintain our spine in an erect position. So when you eliminate that by staying seated either in a sofa or an office chair for extended periods of time, all the muscles of your core, the muscles of your buttocks, the muscles of your lower back are going to become deactivated and much less strong than if you're regularly moving around or doing certain things. And I will go through the things that you can do to help protect you as well.
Right. I know the first time you were on, we spoke very generally about a lot of things.
Yeah.
But I don't know, I see a connection here, and you're talking about not developing our musculature or maintaining our musculature, but when you combine that with what's the words I'm looking for, poor seating, for example, posture, and all of these things, there must be a kind of 2 + 2 = 5 in that kind of equation.
Yeah, you're absolutely right. There's this synergistic impact of the combination of, for example, I can show you if you're on a live stream, if you're on my live feed on Facebook, you'll be able to see this. You'll just have to take my word for it on radio, which is that when we use our mobile phone, we tend to be looking down at an angle. So if we're looking down at our mobile phone, and all of us can imagine what that looks like and what we do, or if we're using a tablet, then we change the angle through our neck. And what that does is it actually applies an awful lot of stress. It amplifies the weight of our head, because that's a very heavy watermelon type object that sits atop a strong but relatively fragile neck, which has then a lot of work to do when your head is tipped forward and you're carrying that weight for an extended period of time. So that results very often in a lot of neck pain, and we can see that with people who work from a laptop, for example, for an extended period of time. Neck pain, shoulder pain, super common. So those types of things obviously are very, very common and synergistic to creating pain in other parts of your body as well. So I was going to outline for your listeners as well at what point should you start to worry about your back pain? Because I thought that might be something that would be relevant for your listeners. And obviously, we wait as long as we can, right? That's so common. we will wait as long as we can before going to see a practitioner. And then what we might do second of all is take painkillers.
Right.
And I really want to try and discourage that. The time to take painkillers is when it's absolutely urgent and when you're struggling to sleep at night. If you're struggling to sleep at night from pain, then analgesics or painkillers like paracetamol, aspirin, even ibuprofen might be indicated and useful for you to do. But if you're taking those drugs to manage your back pain, then you're probably not going to come out the other side very, very well from it. And what you need to think about is the time to go to a therapist is after three things, and I'm going to suggest them very briefly now, and then obviously ask me any questions, or interrupt me, Bill, by the way, which are things like referred pain. So if you initially are getting pain that's radiating down your arms or radiating down your legs or shooting up your spine, any tingling sensation or feeling of burning under the skin, then those are all clear indicators you need to go and see a therapist.
Right.
If your pain has existed for more than a week, then it's definitely worth investigating, because usually we can get aches and pains. Everybody gets aches and pains. We may have done something physical. We may have been sitting for longer than normal. We may have played a sport that we haven't played. And, our bodies react when we do that. But if it's still lingering after 5 to 7 days, chances are it probably needs to be looked at more seriously in order for it not to become a chronic issue, which is effectively a long-term problem. And then in combination with those two options, the last one is if a pain continues to come back. So if you find that you are getting lower back pain for a couple of days, then it goes away for a month, then it comes back for a week or so, then it goes away for a couple of weeks, then it comes back for maybe 10 days, there's something pre-existing in your spine that probably needs to be addressed. And those are indicators. And it's very normal that people will leave very long gaps between seeing a therapist for various reasons. But the efficacy is definitely there to come and see a professional who can help. Yeah,
sure. Okay, so I'm going to be, it's another silly boy question probably, but what range are we talking about when you talk about lower back pain? So where might it start and how far up the back?
Yeah, good question. So posturally related pain is usually from the neck, shoulders and mid-back.
Right.
And lower back pain is anything beneath that. So where we're talking about the bottom of the rib cage and below.
Oh, right.
So that would be your lower back. But of course, you can have back pain anywhere along there, but your lower back is classified as the rib cage and below that, which is effectively your lumbar spine.
Right.
Yeah.
So you say that you treat a lot of this, Marcel. You see a lot of people with this lower back pains.
Yeah.
What kind of ages and what are the roots of these pains generally?
Okay, so the ages of people is variable. I tend not to see 18-year-olds. That I can tell you, it's very rare to see an 18-year-old with back pain that's not happened because of some physical activity or accident or something like that. So we're talking probably 35 plus.
Okay.
From 35 plus, the spine is not the strongest. It's no longer building naturally as part of your bodily growth, as part of your hormone balance, as part of your physicality. So by 35, you might start to notice that your body weight changes. And if you've got an increase in body weight, that puts more stress through your lower back. But even if you haven't, your strength, unless you specifically focus on it, will begin to decline from the age of 35. And some say even before that, but obviously I don't want to make it sound too depressing.
That is depressing.
It is depressing, right? It is really depressing because unfortunately our bodies, if we don't strain our bodies, because if you think about it as well, and I think I've said this every time we've chatted, the older we become, the less we tend to do physically. We seem to think that being physically active the older we become is the appropriate way of looking after ourselves, but actually the opposite applies. The way we're physical obviously has to change. We can't necessarily run around a football pitch for 90 minutes going hammer and tongs, but you might build up to being able to walk at least 30 minutes every single day along the beach if you're lucky enough to live where we live. So, those types of things become increasingly relevant. But also you can have circumstances where, again, office workers, a number of clients come to mind where they have extreme tension through their lower back from a combination of factors. And those factors are emotional stress, work-related stress, and physical stress.
Right.
So if you combine all those three things, and a lot of people are feeling that right now, emotional stress obviously can be, whether it be your personal relationship, your working relationships, physical stress because of the lack of physical activity, so weakening body, and then environmental stress and so on, just not doing very much. Your body will start to do what it can to effectively hold you together, and sometimes it is exacerbated by the muscles, and in particular the fascia of your lower back. And the fascia, which I can go into if you want me to, is a fascinating tissue type that covers most of the body. And it was a form of science that was mostly ignored until around 30 years ago, until they started to realize just how relevant this tissue was. Not to go into too much detail, but it's basically a layer of tissue that sits between the skin and the muscle that has mostly ligament material, which means it's very strong and tough, but it also displays function of muscle, which means contractility, and it also contains nerve endings. So if you imagine, it's like this hybrid of tissue that's receiving signals from the brain, but also able to slightly contract, but also provide support for the body. So it's like, wow, it's a really powerful tissue that I specifically trained and learned to work with in order to create relief of pain, more freedom of movement, all that kind of stuff. And it's called myofascial release, and it's an amazing concept.
So you have 10 patients coming to see you that have lower back pain.
Mm-hmm.
Would your treatment for each of these be the same, or would there be differences?
You're asking secrets now. You see, I'm not sure I can share that, Bill. Oh, no, I'm just kidding. It depends. I mean, this is the thing. If they present with very similar symptoms, it's going to be the same.
Right.
It's going to be the same. So that can be somewhat easier. But if they are presenting with, for example, if it's a structural problem, so if we're talking about herniation, so this is an area of lower back pain that can be a big problem, where you have a disc in between each vertebrae. Again, if you're watching on live, I am using my hands to indicate what I'm doing here. If you've got this stacking of the vertebrae, then in between each of the bones of the spine, you've got a disc. That disc, which is like a spongy material, very, very clever, is designed to provide cushioning in between each of the vertebrae bones, which I think most people know. But as we age, and again from past the age of 35, that starts to change. Those cushions become slightly depressed. They can bulge out one side, left, right, forwards and backwards, so it can go in any direction. And they change with age, or of course with an incident. So with accidents, things like that can be much, much worse. But even just with poor posture, you can change the shape of your spine, and that can put pressure on the discs. Do you want to know one of the best ways to protect your discs, Bill? I'll give it to you. You ready? It's very simple. Water.
Water?
Water.
No, I would have been more interested if you'd said wine.
Sorry. I know. If I'd have said wine, vodka, or sangria, that probably would have made our numbers double, but that's fine.
Yeah. Is that because most of us are dehydrated most of the time?
A lot of the time we're dehydrated, but actually because the body of the disc is 85% water.
All right, okay.
So there is an incredible amount of research coming out now where the solution for people with, and what they now term it as dehydrated discs for that reason, is the solution is the consumption of high levels of water, obviously controlled, because you don't want to have loads of water. You can end up actually drowning, but you have much more water than you would in your average day, and that has resulted in incredible transitions from people with back pain because of the dehydrated discs and the pressure that might then put on the nerve roots. it actually has reinflated them in effect, and that is something that's been amazing, incredible results with that, and it's just water, high volumes of water, but you do need to get diagnosed.
Yeah, sure. But before this was discovered, would people typically have been operated on? For
Good.
This kind of
Yeah, excellent question. So you had a number of paths. One was highly medicate. So you take a lot of painkillers to try and cover up or reduce inflammation, anti-inflammatories, things like that. Invariably not very effective. Corticosteroids, which is an injection into some part of your body, which a lot of people are familiar with. Which again has a very low success rate. It's got a 50% success rate and it lasts 3 months on average.
Right.
That's what the science says, but they still do it an awful lot.
I think it hurts as well.
Sorry?
It hurts as well.
There you go. So it sounds like somebody's got some experience. All right, so it's not very comfortable either to have, exactly. So it's purely a temporary measure. Then, of course, it's surgery. So a person could potentially be submitted. Surgery is indicated usually much better now because it's indicated as a last resort, and it's indicated when it's absolutely necessary. Now, surgery at times can provide an amazing solution. So surgery can be, and people have probably heard where they've had the disc has either been deflated, effectively almost extracted, where you can almost have a fusion of the two vertebrae then touching each other. That in itself can provide a very good long-term solution for people in managing their pain, but it will always provide a limitation in movement and the potential for risk later in life as well, depending on lifestyle and activities. So, it's surgery can be very, very effective, but again, it's usually considered an absolute last resort.
Yeah, so really some kind of treatment at an appropriate time
Yeah.
is a far more successful way of dealing with it.
Definitely.
When it's got to a chronic stage. Yeah?
Correct. I mean, this is where prevention becomes a relevant topic of conversation, which is that if you feel like something doesn't feel right, you can get it probably resolved in a much shorter time frame, and then it won't affect your life much later on. If you tend to ignore it and just try and live with it or work through it or train with it, chances are when it becomes chronic, it beds in and it takes longer to heal. And then later on, it becomes a bigger problem. And then your life is changed permanently, perhaps, later on because you have to do something.
Okay, Marcel, we're going to take a short break
Okay.
just now.
Yep.
And then we'll come back and get into some more of the detail around this. I find it very interesting because
Cool.
I think it's relevant to everybody.
Yeah, it really is.
Over to you, Dave.
Looking for a low-cost removal to anywhere in Europe and the UK? Visit our website, europeanmoving.co.uk.
Okay, so those of you watching, thank you so much for watching us live. I hope you're enjoying what we're doing. I'm just going to nip out and get a glass of water, but we're just on an intermission here, and then we'll be back soon.
Hi, I'm Sarah. Friend, it was my job for a global company. Of course we speak English to each other, but what about after work? When shopping, or class? At times like these, I feel like I'm still a stranger. In London I have friends, but here I just have colleagues. But what is going to change now? I'm learning French with expatfrench.com. Live lessons with qualified teachers who are native speakers, online and flexible. It's just perfect for me. How about you? expatfrench.com.
Start a new business or relocate to a European country that is pro-business, where people are friendly and the climate is warm. Malta, located in the middle of the Mediterranean, just south of Italy, offers a number of attractive options to help you with your situation. Whether you wish to set up a new business or relocate to an adventurous residency location, Papilio Services can assist you with high-quality corporate, residency and tax services in Malta. Find out more by visiting us at www.papilioservices.com or call 00356 2122 755 3 to learn more.
So hopefully if you guys are enjoying the live video here and you're getting some value from it, please put any questions or comments that you might have down below. Feel free to share this video as well if you think somebody might get some value from it, okay? But thanks very much for joining us if you are. All right, I hope you're having a good day.
Or the extent of their losses. That's why we offer a completely free and no obligation pension
So what are you waiting for? Get your pension Beat the Banks checked. Call 01382 200 474 or visit beatthebanks.co.uk.
You don't have to use the services of a regulated claims management company. You can make a complaint yourself for free directly to whomsoever you believe missold the financial product.
Sustain Health magazine online for everything you need to live a happy, healthy and prosperous life, from mental to physical wellbeing. Be sure to subscribe now at www.sustainhealth.biz.
You're listening to Expat Radio, beaming out across France and around the world.
Well, welcome back. I'm Bill Anderson. I'm coming live from the Costa del Sol with my guest, Marcel Salazar. Marcel, welcome back.
Thank you.
We are talking about things that hurt, lower back and sciatica. And you've explained, I think, very well, the things to look out for and what sometimes causes lower back pain. Probably there are not many people listening today that haven't experienced at some point in their life this kind of lower back pain that makes you whinge when you try to stand up.
Correct.
Or, just certain movements, you think, no, it's okay, and you turn a particular way. And
Yep. And it's a global statistic of 80%.
Right.
So it's a reality for a lot of people for different reasons.
In terms of treating, let's not go in a moment to sort of specific cases, but in terms of treating, I mean, what are we talking about? Is it massage, manipulation?
Yeah, good. So it will be those types of things. So firstly, what's crucial is I find it very important to find out a little bit about the background of the individual in terms of what are your daily habits, maybe there's a nutritional thing. This is involved in a proper consultation effectively. So if you are going to a practitioner, and maybe not myself, then it's important that the person that you're going to see for this purpose tries to find out a bit more about you. Because an element of my work is actually investigation. It's a bit like detective work, which is quite good fun. So it's about finding out what is the cause of this? Why is this happening? What can we do to prevent it? What changes do we need to make maybe? So the therapy will first of all begin, of course, with the consultation about finding out why, root causes, where's it coming from, allergies, all sorts of things like that are relevant. And then the treatment involved is absolutely the things like the myofascial release technique is something I've already mentioned. Deep tissue massage, which is again applying specific pressure to certain parts of the muscle or the musculatures. Also electrotherapy. I do have electrotherapy equipment as well, which helps to manage pain as well as stimulate muscles.
Right, so you plug people into the mains.
I plug them in, yeah, exactly. Don't be afraid by that, okay? That's just a joke. I'm not plugging people into the mains. It's a small device with a small battery, and don't worry, it's very controllable. You'd be amazed at how many people get scared by that.
Is this similar to a type of acupuncture?
Acupuncture is obviously slightly different, but the efficacy of acupuncture is using your own body's neural pathways.
Right.
As a method of control. But this one is using an external stimuli to do a very similar thing.
Right.
And whether that be to create activation through the muscle, through electrical stimulation, or whether that be to block pain through the neural pathways, which is, again, the gate theory, which, if you're interested, we can talk about. But it's basically a way of trying to block the perception or reception of pain in the brain. So those are the ways that it's useful. And then I also use a massage gun sometimes as well. And then I also do some very light manipulations as well, whereby I will gently guide the articulation or the joint or the specific part of the spine into relaxing and releasing. And that's a very gentle art form because that can be done much more aggressively. And can create a little bit of a problem, but otherwise that's something that I find is very, very effective as well.
But I think what you're saying here is really quite important. You know, I've got something that hurts, so I say to my wife, "Oh, give that a good rub for me. Oh, press harder, press harder." Actually, Vicky has done sports massage and various things like that, so she kind of knows what she's doing there. But, you know, we have to be careful that if there's something there and you say, "Oh, would you just rub that for me?" The person, I'm not talking about a therapist now, but the person is not actually potentially doing more damage than good.
That's right. So to reassure the listeners, obviously, and the watchers, it is important to know that it is quite difficult to make it worse if the person is mobile. You know, if they're moving around and they're not too debilitated. Even applying a little bit of pressure. Now, that doesn't mean I'm recommending that you do it, of course, that you apply a lot of pressure, but you can work on somebody who is not in a lot of pain to try and relieve some tension. That's absolutely fine by doing some deep pressures or by doing a shoulder rub and things like that. That's absolutely fine. But if a person is really debilitated, they've got sharp pain, they're really locked up, they're flat on the floor and they can't move, your best bet is to make them as comfortable as possible and then get them to or get somebody to them who can facilitate, because unfortunately you can create other problems by trying to create a solution that maybe you don't have the skills to manage.
Yeah, and for those who are listening from other parts of the world, to explain that in Spain, we actually have a very good health service, but getting this kind of treatment on the health service at the time that you need it is pretty much impossible, isn't it?
Yeah, very
so,
difficult.
you know, people do tend to go to private practitioners for most of these types of therapy, because, you know, if you've got that kind of pain, you need it dealt with now. Yeah. Not in 6 weeks' time after a visit to your consultant, and then back to your GP, and then a referral to a physio and whatever. I'm not saying the physios are not good, but it's the time scale.
Absolutely. That's the relevant factor. That's exactly it. If you were able to get in at the same speed as coming to a private practitioner, the physiotherapists, you're always going to find variables in quality, but the physiotherapist invariably will be able to cope, manage and deal with whatever the condition is. But if you're having to wait 6 to 8 weeks, 3 months, etc., you've then got a problem that might come and go, become chronic, then it extends, and so you're creating a bigger problem. And that obviously makes it very difficult for certain demographics of people who either can't afford it or have time limitations, etc. But coming to a practitioner who is able to see you immediately very often makes a huge difference to the overall outcome and the time frame involved as well.
Yeah. I know we're going to talk about sciatica, but I've got a couple of other questions that I want to kind of throw out to you. And this is just to do with getting older. And, you know, one you kind of touched on to some extent is the wear and tear, and you know, particularly on the discs between the individual vertebrae. Yep. And the other, which I think is something, well, I didn't think about it, but it's come up in conversations on a number of occasions recently, and probably more relevant to women, is scoliosis. Yeah. How do these things sort of impact on, well, firstly, back pain, and secondly, treatment? Yeah. So scoliosis at the moment is still very much considered to be, particularly in earlier life, is a congenital issue passed genetically onto the individual. Later in life, it can be posture related, but again, there's still indications that it's far more likely to be a congenital degenerative issue related to your gene pathways. So just to identify and clarify as well, scoliosis, of course, is a curvature of the spine. You've got two different kinds. One is scoliosis, the other is kyphosis. And so the scoliosis is like an S shape, where the spine goes laterally, shall we say, and the kyphosis is when it goes forwards, or you arch forward, and you see that very commonly in people, particularly in women, actually, where you get the hump at the base of the neck. Right. And that can become worse, or much worse, you get the full-blown curvature bending forward of the spine. That is a
a degenerative change that can be slowed down with physical activity again.
Okay.
It seems like I hark back to the same thing, but it's it's very, very true, because effectively what's happening is gravity is having its effect on you, and if it's going to happen, it's going to happen faster if you allow it by facilitating gravity by not doing anything.
Right.
Whereas if you do something that works in opposition to gravity, for example, applying traction, stretching, strengthening, building up the articulations, the muscles and the joints, then it's going to slow down the process of any curve in any one direction, you see? So that's where the exercise comes in. Now, what types of exercise are we talking about? Well, it could be Pilates, it could be yoga, it could even be a gym workout, but specifically designated towards that agenda. So if you have that in your history, it's important to share that with whoever's working with you. So I'm a strength and conditioning coach by training. So again, I would work with individuals, create programs in the gym environment in order for you to do by yourself. So you would crack on, and then obviously if you needed guidance, I would be there for you. But obviously personal trainers, if you believe and trust and you're happy with them, they can absolutely construct something just as adequate potentially as well, wherever you are in the world. But do try and make sure you get guidance on that. But that can absolutely slow down the process of curvature, either laterally or curvature, as well as simple things like lying on the floor. Lie on the floor on a flat surface, ideally on a mat, a yoga mat of some description, and just use your own body weight by stretching up, tucking your neck in, and allowing gravity to provide traction in reverse. Because again, we don't often find ourselves lying flat on the floor. And that's a very effective way, and it's usually fairly painless. It's a slow process. It's not something that's going to go from nothing to amazing in one sitting, or one lying, should we say. But if you do that regularly, where you're stretching out, lying on the floor, reaching up above you, it's going to relax your spine into a more natural position and open those facets.
This is part of the problem, though, isn't it? That we're kind of used to expecting to go somewhere and get the magic bullet.
Yeah.
That's going to sort it.
Yep.
And with a lot of these things, as you said, there is no magic bullet. And if people think that, the pill is the magic bullet, it might take the pain away, but...
Yeah, it's a culture that's been created on purpose, which is we get a shot and all our problems are solved. However, we know more now than ever that that's actually not necessarily the case. So, a single pill will mask something for a few hours, but it's never curing the problem. It's not necessarily, it's diminishing the sensation, but it's not curing the problem. So that's what's really important to be aware of. You might find that you don't get the pain thereafter if you're lucky, but it's not got rid of the fundamental problem that caused the pain in the first place. So the chances of it coming back are high.
Yeah. And there was something that flashed through my head there just a second ago. It's very, very simple that, pain exists for a reason, doesn't it?
Yes, exactly.
I think that pain is a bad thing.
Correct.
We like it, or most people don't like it.
Yes, it's got a bad rap.
But it is there for a very good reason, and it's to protect us, isn't it?
Correct. And acute pain is absolutely designed to protect us. The problem comes with chronic pain, and this again harks back to the danger of leaving it too long. Because chronic pain is telling us that's where the problem is, that's how severe it is, because you've either got a lot of pain or a little bit of pain or medium amount of pain, and you probably should stop doing whatever it was that caused that pain in the first place. So you ideally get that resolved and sorted out. But if you leave the chronic pain, or the pain to become chronic, what then happens is that the messages start getting confused. And what happens is you start to get pain somewhere else. And then you start to get pain somewhere else. And then you start to get pain even when you're not doing what might cause the pain. And then the pain is there even when you don't have a problem. And that's very chronic pain. And that I've seen a lot as well, where you're in this what's called the pain cycle. And that's a problem because you have to break that. And that takes more work. So the pain is absolutely effective, but it becomes a much bigger problem when you leave it for too long a period of time. But pain effectively lets you know, one, that you're alive, and two, acute pain that is, one, that you're alive, and two, where the problem is. after a while, that becomes a bit more confusing.
Yeah.
Yeah.
I'm going to throw one more sort of wobbly into the equation.
Yeah.
Here, and that's, again, something that will affect women predominantly, which is the osteoporosis.
Yes. Now, I like this one. Now, this is going to be a little bit controversial here again. I like to be a little bit controversial. So the topic of osteopenia, which I'm sure a lot of women have heard about. Osteopenia is the precursor to osteoporosis. Okay. So osteoporosis is, by the way, the thinning of the density of your bones, which is something that you may have heard of if you're in the old 50 plus. Then you will have heard about that as a possibility. But a lot of people will have heard about osteopenia. And osteopenia is a relatively new medical condition, which is the precursor. So this is where a medical person can say to you, you are slightly osteopenic based on this result here. I recommend that you start taking such and such things. Now, osteopenia was effectively created to sort of as a warning signal to osteoporosis, which is not ideal because it makes your bones brittle and it makes it more likely that you're going to fracture a bone if you have a fall. And it's important to try and prevent that, and I'm going to talk about that. But osteopenia was created as a way to sort of prevent the possibility of osteoporosis. But what they did was initially the requirements, the cursor requirement to be in that category was quite narrow. So the sort of the indication of what's called a BMD or bone mineral density test was relatively narrow in terms of from one key point, let's say 1.5 to 1.8. If you were there, you were osteopenic. But for some bizarre reason, the health professionals decided to massively increase that osteopenic window, which allowed and opened up a lot more people to be given and recommended preventative medications. You see, so that was very clever. It was very, very clever sort of idea to expand. So if you are told the term osteopenia, don't panic. But start to do things that will help protect your body. And the things that will help protect your bones are... I'm going to let you guess what this is, because we've said it already. 3 guesses.
Drink water.
No, this one isn't related to water. This one is related to exercise. Exercise. And it's exercise because when you load your muscles, the stress of that load gets transferred to the tendons. And the stress of that load gets transferred from the tendons to the bones.
Right.
Over time, we're talking over 6 months plus, that begins to have what's called an anabolic effect on the bones. So that's where the bones become thicker, more brittle, more strong, more dense, and so on and so forth. The reverse happens the less physically active we are. So if you look at somebody who weight trains a lot and you look at their bones, they will have very thick, strong bones because they're constantly loading their body. They're loading the joints, they're loading the bones and so on. So exercise is one aspect that's very important, and in particular strength training. And I've said this in a previous show that we've done, which is that women in particular must consider doing exercise, ideally strength-based exercise. Once they hit 50 plus, if they can start to do more strength-based exercise, it's going to protect them forever. Simple as that. In addition to that, nutrition. So that's when we start to think about whether we need to amplify natural sources. Now, the prescriptions very often for osteopenia and osteoporosis is calcium. Calcium, unfortunately, yes, in small volumes is effective if our diet is not sufficient in calcium.
Yeah.
But the dosages that are often recommended are way above what's necessary for the body to function, because calcium is important for muscle function as well as bone density. But it's more relative to muscle function, because you can't have muscle function without calcium. Okay, that's a fundamental. But bones are made up of many more minerals than calcium. So you can take much more. Now, what I would recommend is one of the best sources of calcium, actually, aside from vegetables, because you can get incredible calcium from green vegetables, by the way, broccolis, asparagus, The rest all have escaped me. But look it up, you'll find it.
Brussels sprouts.
Brussels sprouts, great sauce. Brussels sprouts are highly nutritious. I can't stand them. But my mother keeps telling me to take them since I was a child. She loves them. I can't do it. Anyway, but green veggies, fantastic. Now, one of the best sources is small fish.
Oh, okay.
If you like small fish, or if you're lucky enough to live here, sardinas, where the fish actually itself is not only fresh, it's full of omega fats, it's full of the protein from their flesh, but you also consume their tiny little bones. And I'm not suggesting that you choke, obviously. The idea is that you eat their tiny, tiny bones that you don't even notice. Your body will reabsorb that. It will break down their bones, release all their minerals into your body, and eventually over time it nourishes your body. Now that's a far more effective way of rejuvenating your nutrient levels in order to impact your bones. But one of the most powerful ways is exercise, for sure, because you have to load the muscles to then create this anabolic effect.
So we're going to get everybody rushing down to the beach bars, the beach restaurants.
Absolutely. Support local business.
A skewer of sardines.
That's right. Support local business. Absolutely.
Okay. Just on the general issues of this lower back pain, is there anything you want to say to kind of round this up, Marcel? Because we want to go on and talk about
the sciatica. Yeah.
Is also really important.
Yes, so lower back pain is fundamentally caused by a weakness of the core. And as a very simple sort of nutshell to take away, a takeaway should we say, if you want to strengthen your back, don't just think about your back. Think about your abdominal muscles, your oblique muscles, which are the ones that run from your ribs to your hips, and think about your inner thigh muscles called the adductors, and then think about the abductors, and those are the muscles of your buttocks, above your buttocks.
Okay, I'm thinking about my buttock right
Good,
now.
excellent, always thinking about them. Good, I'm thinking about them too now, Bill.
Right, okay, time is going incredibly
Yes.
quickly. So I want to go back to what you said right at the beginning. Sciatica, a lot of people think they've got it, but they haven't.
Correct.
Tell us what it is first, and then tell us what it's not.
Okay, so the sciatic nerve originates at the base of the spine. It's quite a large nerve, and it has to be because it runs from the very base of the spine all the way down to your little and your second toe.
Right.
So, if you have sciatica, what that is fundamentally it's a pinching of that nerve, probably somewhere at the base of your spine. And you will receive pain signals all the way down the back of your leg, behind your knee, potentially down your calf muscle, all the way to your little toe.
Right.
That is your classic sciatica, generally speaking, but specifically that is usually the red flag for sciatica. Right. If you have pain that radiates just in your buttock, or sort of feels like it's kind of emanating down towards the middle of the upper thigh, that could be something else completely. And the condition that's very often confused with sciatica is actually called Piriformis Syndrome. Okay. Piriformis Syndrome is a different thing, but there's a reason why it gets confused. First of all, the piriformis is located deep underneath the glute muscles. So the glute muscles, of course, are your buttock muscles. And the piriformis is beneath that. So it's super deep and it's right in the hip region. And what it does is it effectively attaches to your femur bone, which is the long bone in your upper leg, and it reattaches to the pelvis. And what it does is it actually goes across, it goes laterally. And it helps with what's called external rotation and abduction of your leg. So it's taking your leg away, effectively. Now, that muscle is very important in various support network for your lower back and your pelvis and your hips and so on. But again, in a seated position for extended periods of time, it misbehaves.
Right.
Now, if you have piriformis syndrome, effectively it's either swollen, it's gone into spasm, it's slightly inflamed, it's irritated. Now, the reason it can get confused is because it runs super duper close to the sciatic nerve.
Okay.
Now, interestingly about this one, interesting for me, is that the sciatic nerve runs either atop the piriformis, beneath the piriformis, and in some rare cases, in 50% of people, 15, it runs right through. So if it runs through the piriformis muscle, then of course any form of reaction in your piriformis, and you're going to feel like it's sciatica. But because the pain signals will be different, you probably won't get the reaction right down to your toe, and the chances are it's more Piriformis syndrome than it is sciatica.
And would you treat these two conditions separately?
Yes.
In different ways?
Yes, you treat them differently because the origin of your problem for sciatica is probably the base of your spine.
Okay.
And the origin is the deep buttock, which is where you would then treat with deep tissue release techniques, mobility exercises, traction through the piriformis, which is extremely effective. And because that is very common, so 90% of people have piriformis syndrome over sciatica. And that syndrome is much easier to deal with generally than sciatica. Sciatica is a more serious condition.
Right. I think that's quite interesting because I think if in general, if people feel they've got this pain coming down towards the thigh, they would say, and I've probably done it myself on occasions, I think I've got a touch of sciatica.
Yeah.
But from what you're describing, it probably is something quite different.
Yeah. It's very, very common and it's easily mistaken. And of course, this harks into where we do the self-diagnosis thing. We go look it up on Google, and Google either tells us our leg's about to fall off or it's probably sciatica. But what it doesn't often say, unfortunately, is that it's Piriformis syndrome. So that's very commonly the cause of your pain. And the good thing is, that the Piriformis syndrome is a much less of an issue. I mean, it's painful and it's uncomfortable, but it can usually be resolved very effectively, usually quicker than sciatica.
Okay.
Yeah.
And again, this is done by sort of deep tissue massage.
Yeah.
Or
mobilization activities, deep tissue release, myofascia, not necessarily any electrotherapy, but yeah, and then some rehabilitation as well afterwards.
Yeah. And you said traction, so really the whole stretching of the muscle.
The muscles, exactly. Opening out the joint itself and then stretching the muscles in a very effective way. Yeah.
Right. And is this something that you see regularly as well?
Yes, it's super common. Yeah, sciatica is probably something I'll see once every 6 months, but Piriformis syndrome I'll see it probably once a week.
All right. Okay.
Yeah.
And again, you probably have to explain to people what it is they've got. That don't worry, it's not sciatica.
That's right. Yeah.
And with sciatica, the treatment, how would that differ from?
Yeah, so usually with sciatica, what's happening there is we need to establish whether there's a mechanical issue in the base of the spine that's causing pinching of the nerve root.
Right.
And then it would be a case of trying to relax the surrounding muscles and manipulate to free up that nerve pinch. Yeah. So that would be the treatment protocol. But there would be some crossover, potentially some massage to relax the base of the spine, to relax the muscles around the glutes. But ultimately, it would be about freeing up the nerve root and repositioning the facet, which might be the cause of the problem.
Okay. Marcel.
Don't tell me we're time up.
The time has gone again. I think, for me, this has been very interesting. I actually keep reasonably healthy, although I'm not terribly fit. But even with that, these are the kind of things that are, I will have I might say it's a stiff back. It might last a day. It might last half an hour. But this kind of pain, I think, is so universal.
It really is. It really is. What I'd like to do is suggest ways to prevent it.
Okay.
Very simple. Walk. If you can walk regularly. So if you do have a sedentary job, or you are somebody who sits at home either watching TV or you're doing work, whatever it is, try and walk with a certain agenda for a minimum of 15 to 30 minutes. But you can do that 3 or 4 times a day. There's no reason to do that once. If you struggle to walk for 30 minutes in one sitting, break it up, but try to do it more frequently. So it's not enough to just do 30 minutes a day. Ideally, you want to try and do that multiple times, or ideally, you want to do that on more difficult terrain or in slightly new environments, by the beach, things like that. Things that will put a little bit more progressive stress and what's called progressive overload on your body.
Right.
Now, that obviously then leads into things like if you can ride a bike, ride a bike. If you can swim, that's great. That's fantastic too. Sex is very important. Very, very useful terminology. I'm sorry if I'm alienating some people here, but it's a very good way of maintaining strength in various places.
You might need to explain what it is to some people these days.
Sex.
Sorry, I don't mean to joke.
Yeah, I don't think I'm going to go into that detail. We've just run out of time, I understand, but I would highly recommend it. But yeah, that's a very good way of maintaining strength as well, because it's a physical activity.
Absolutely.
So
I'm all for
100%. I'm 100% behind it. Yeah, I know you and I are. Anyway.
Marcel, thank you so much for joining me again today.
You're so welcome.
It's been really interesting. And now that you have the love of your life back with your family,
yep,
I thought we should go out with a nice Elvis song.
Yeah.
Just for your wife, and we'll make it for Vicky as well.
Why not? Why not? She'll love it.
Thank you. Have a lovely weekend.
Thank you. Same to you. Thank you so much for having me again.
Thank you.
Take care. Bye-bye.
Best music on the best station.
Expat Radio.
All right, guys, I hope you enjoyed that. Thank you so much for those of you who joined in. I hope you got some value from it. I'm going to have to sign out. Got my next patient here, so let me know what you thought. Put your comments below, and you'll see us on the next show, which will be at the end of what is September. My God, last Friday, every Friday, the last Friday of the month. Okay, thanks for watching. See you again soon.